and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Large crowd gather at Okwebi scene of helicopter crash in Lagos. COVID-19 safety protocols absent. Edo government commissions first private molecular diagnostic laboratory in the South-South region. And Egypt's mosque held first Friday prayers since March when they were suspended. We begin in Africa, a continent that has recorded over 1.2 million coronavirus cases, with more than 942,000 and over 28,000 deaths. Of course, 942,000 recoveries. According to the Africa Centers for Disease Control and Prevention, the continent has seen a 20% decrease in confirmed COVID-19 cases in the past week, but warns that we shouldn't go home celebrating that the pandemic is over. The continent's CDC says testing and other efforts to contain the virus are largely working, but just 1 or 2 cases could reignite infection. Now, 23 of Africa's 54 countries have reported a sustained decrease in new confirmed cases. In West Africa, the Nigeria Center for Disease Control, NCDC, confirmed the total number 296 new cases of COVID-19 in the country. The cases are reported from 16 states and the Federal Capital Territory, Plateau taking the lead with 85 cases, followed by Enugu 46, 31 recorded in Oyo, 21 in Lagos, 20 in Rivers, 15 in the nation's capital, 13 in Kaduna, 12 in Bauchi, 11 each in Delta and Ekiti states, 7 in Akwa Ibom, 6 in Ebonyi state. Kwara state recorded 5 from the new cases. There were 4 recorded each in Ogun and Osun states. Gombe recorded 3 and Niger state recorded 2 cases. Till date, 53,317 cases have been confirmed, 40,726 have been discharged, and 1,011 deaths recorded in the 36 states and the FCT. Sadly, there's been a helicopter crash this afternoon in the Okwebi area of Lagos State. The crash occurred around Salvation Road, leaving 2 people dead, 1 injured. According to emergency services at the scene, the person who was injured was rescued. He was receiving treatment at the Lagos State University Teaching Hospital. At the scene was a large crowd of onlookers with no physical distancing, most of them also not wearing their face masks, a few of the COVID-19 protocols to prevent the spread of the virus. Sources from the Federal Ministry of Aviation identify the aircraft as a Bell 206 owned by Quorum Aviation. Reports say there were 2 crew members and 1 passenger on board the helicopter, which had flown into Lagos from Port Harcourt. Well, joining us to look at the safety measures during emergency operations, we have joining us here in our Lagos studio, Mr. Chris Aligwe. He's an aviation consultant. We'd like to thank you for joining us on the program.
Thank you, Millicent.
Terrible news in Ikeja today. Before we get to perhaps what we saw in terms of the crowd, what do you think went wrong that led to the crash?
Thank you. It's not possible to tell you what went wrong, even if I know. One, I don't know, but even if I know, it's against all professional ethics in the industry. It's only the AIB that can say this is what went wrong. In any accident, nobody, no professional can tell you this is, even if he has a clear idea. So we don't do that in the industry. I don't know what went wrong, but even if I know what went wrong, it's the most unprofessional to tell you. So
well, what
it
about
is to
what
wait.
Could have gone wrong?
No, either that's speculation. It's against the norm in the industry. Not even the not even the DGNCAA, well, not even the minister will not tell you, DGNCAA, even if they know, the statutory body that can say it is the Accident Investigation Bureau. That's so I don't know. I won't tell you lies, but even if I knew, I won't tell you.
So because there's also perhaps, an angle to this where a lot of people are saying since COVID-19, we've had the aviation sector grounded, a lot of aircraft grounded as well. And so in that, as of course flights are resuming, we're having domestic flights that have already resumed. Is there a situation where if you don't have an aircraft that is serviced, it could lead to this kind of emergency?
No, let me tell you, that's a pretty wild speculation. I tell you, the NCAA, if you know what the NCAA has been doing during this period, they've gone beyond even the standard. What they put in place is by far much more than what should be the normal, because they know that aircraft on ground, that, look, if you don't take care, things would have gone wrong. Even if you park your car on the ground, when you want to get back to it, one thing or the other. So they went through strict process of recertification of all the airlines and of operators. And so they didn't leave anything to chance. That's why I say if you leave people, that's the first speculation they will go to, because the aircraft have been on ground. It is not true. I know that the safety directorate of NCAA has been on their toes all throughout this period. Any aircraft that you see flying would have been certified by the Nigerian Civil Aviation Authority. And there's no aircraft that flies that has not been certified. That's why one can confidently say to people, you can fly any aircraft you see that is ready to fly, go, because it has been certified. So that speculation should not be there at all.
Sadly, this is also the first crash we're seeing since COVID-19, a pandemic the whole world is battling. We also saw that there was quite some crowd, a number of people gathered there. What should be the risk-based approach to handling such emergencies, seeing as COVID-19 also there should be physical distancing, face mask wearing, which largely was not adhered to?
Thank you. The first thing is one commiserates with the families that lost their loved ones in that aircraft. We are all of the same aviation family, all being Nigerians. But see, it has always been a problem when there are crashes, particularly in the past. But even if it happens today, you see the same problem. People from all sorts of everywhere will gather. There are some who are genuine, who are coming in there to save lives. There are others who are not genuine, who are coming in here to do other things. And that's why it's always a problem for us, for the industry, because immediately an accident happens, what happens is that place should be cordoned off, because there are materials you need that, for the investigation. And people coming in will not know which material. And that's why such places should be cordoned off immediately. I saw many people, different people trying to. Yes, the first thing is to save lives. But after saving lives, you go away. You don't even start touching. You don't just touching parts of the aircraft and whatever, because these are areas, these are things that we use for analysis. They'll be taken to lab, because you don't know what part of the aircraft that is required to identify what may have happened. It might just be, you can see it as just a mere piece of the frame, the airframe. You think that is something to be taken away. No. So what normally should happen, what normally happens in civilized places, if such things happen, that entire place should be cordoned off. The thing is that we have challenge of quick response, because...
Talking about emergency agencies.
Yes. Emergency responses is a NEMA. You see, there are agencies that... should come in there because of the human beings. There are agencies. One, AIB. AIB should be the first agency. NEMA, AIB and NEMA, National Emergency MENA should be there. AIB. Then you have NCA. NCA is just there to watch. AIB has its statutory responsibility. But then to cordon the place, you have them and you have the security forces. Security forces are not supposed to do anything. It's to make sure there's only the authorized people, authorized staff that should come into that place and do what they should do. After first rescue operation, yes, because we're not quick at responding. So people who are there, the tendency is to, if there are people to be saved, you can rush in and save those people. But the aircraft, no part of the aircraft should be touched. Okay. We have had situations in the past where we even lost the voice data recorder, which is normally called the black box. Immediately the black box is lost, then the problem about identifying what happened becomes very critical.
All right. Well, Isa, thank you. Thank you so much for your insights into this issue. Aviation consultant, Mr. Chris Aligbe, thank you for joining us on the program.
Thank you.
Now, the Taraba state government is asking residents to stick to safety measures to curtailing the spread of the pandemic in the state. According to the state's deputy governor, Haruna Manu, COVID-19 is still with us. He said this while briefing journalists after a closed-door meeting with third-class chiefs, asking them to re-educate their subjects on the dangers of flouting the NCDC guidelines. According to him, stemming community transmission is still key in the pandemic fight.
Cases that we had in Taraba State, they've all been treated and discharged. We've not had any case of death in Taraba State. We thank God for that. But we still need to be very, very careful. The pandemic is still here. So we have highlighted to them so that when they get back to their various communities, they can educate their people, because we've already educated them before, but educate our people that the pandemic is still very much around. So maintaining social distancing is still very, very important. And of course, we should listen to our health official. They are the expert. Whatever they tell us about this, we should try as much as possible to avoid to adhere to what they have advised us.
Edo State has added a new COVID-19 testing center to its list of testing facilities in the state. This brings the number to 4 located in Benin City. The facility is a private one and being referred to as the first private molecular lab in the South-South region. While commissioning the laboratory in Benin City, the state capital, the governor of the state, Mr. Gordon Obaseki, believes that government should create adequate space for the private sector to participate in healthcare delivery, adding that his plans are on to make Edo State the healthcare hub of Nigeria.
This hospital today is quite, that's being commissioned is quite different. Apart from it being a day clinic, it tells us that there must be business. There's demand for medical services. That's why this group of very entrepreneurial doctors are taking the risk, putting their money up front to put the investments to provide medical services to our people in Edo State. But beyond the regular medical services, they have on their own invested in a molecular laboratory, a PCR laboratory that has the capacity to also test for COVID-19. With this PCR laboratory, Edo State now has 4 testing facilities. Benin City alone has 3. And this one is unique because it's the first privately owned PCR testing laboratory in the south-south of this country.
Still to come on the program, President of the United Nations General Assembly calls for more efforts towards the COVID-19 fight. Do join us again. Welcome back. President Muhammadu Buhari attended the second extraordinary summit of the Economic Authority of Heads of State and Government on the socio-political situation in Mali. Now, besides Nigeria's president, who attended virtually, all the ECOWAS presidents were present. Alongside the ECOWAS president, Jean-Claude Bro, also physically present at the State House Abuja, were the Chief of Staff to the President, the National Security Advisor, the Minister of Foreign Affairs, Minister of Defense, and the Director of the National Intelligence Agency. Discussions were on finding a lasting solution to the political instability in Mali, where President Buhari asked the military junta there to set an acceptable timetable for a return to democratic government, since the country cannot afford to stand alone in the sub-region. As at the 27th of August 2020, the West African region has confirmed 772 new cases, made 1,041 recoveries and 9 deaths. Nigeria still maintains the highest number of active cases at 11,580, also confirmed cases, while Senegal has the second highest cases on admission at 4,042, and we have the Gambia in third place with 2,063. President of the United Nations General Assembly, Mr. Tijani Mohamed Bande, is calling for joint efforts by the international community to fight against COVID-19. He called for equitable access to the COVID-19 vaccine, urging the international community to ensure affordable pricing once the vaccine is developed. He also stressed the necessity of reducing the impact of COVID-19 on poor countries.
I think one is to continue the scientific collaboration among scientists around the world, and to also have the understanding that if vaccines or other therapeutics that have been found that are effective, let there be clear understanding that they're effective for everyone, and that it's clear that there can be no solution to the pandemic on the basis of nation states. And this is important. And I think more and more, this understanding of the connection between the scientific community who work together to create, to have vaccines, and to also find means of getting the vaccines available to those who need them, regardless of their circumstances, I think is absolutely important.
Professor Miriam Aminu is a professor of virology, head of the Department of Microbiology, Faculty of Life Sciences, Ahmadu Bello University, Zaria. She joins us via Skype. Thank you for joining us on the program.
Thank you for having me. Good evening.
All right. Good evening, ma'am. It's been a while we spoke, I believe maybe over a month ago, but we've noticed changes in terms of the number of daily cases we've been recording. I want to get your view of the virus trajectory, perhaps in the last few weeks since we stopped recording 500 cases. And this is, hoping that we will stay at 200 and even go lower. What do you think is happening with COVID-19? Oh dear, I think we lost Professor Aminu. We'll try to get back to her for more on that. But let's tell you what's happening globally. Large mosques in Egypt, they've held Friday prayers, and this is for the first time since they were suspended in March. Worshippers followed precautionary measures, including wearing the face masks, maintaining physical distancing, and bringing their own disinfected prayer mats. Now, the sermons themselves were limited to a maximum of 10 minutes. There have been about 98,000 confirmed coronavirus cases in Egypt and just over 5,300 deaths. Take a look at our global update.
Residents in Paris on Friday did not show any reluctance to abide by a new rule making the wearing of masks compulsory in the city as the French authorities seek to curb a surge in coronavirus infections. Until now, wearing masks was mostly required in crowded outdoor areas in the French capital. Britain's government is urging people to return to offices and other workplaces where it is safe to do so to help the economy recover from the COVID-19 pandemic. Local media reports that Prime Minister Boris Johnson is expected to launch a campaign extolling the virtues of returning to the office and providing reassurance that it is a safe place, while a new online tool will help people avoid the most crowded trains and buses. Large mosques in Egypt have held Friday prayers for the first time since they were suspended in March. Worshippers followed precautionary measures, including wearing of face masks, maintaining physical distancing, and bringing their own disinfected prayer mats. The sermons themselves were limited to a maximum of 10 minutes. Finally, the U.S. has bought 150 million rapid coronavirus tests as part of a $750 million deal with Abbott Laboratories. Earlier this week, the country's Food and Drug Administration granted emergency approval for the firm's rapid test, which the company says cost $5 and gives results in 15 minutes.
Now, we have a number of more cases coming up talking about the coronavirus updates. If you take a look at our website, channelstv.com, you will find President Trump and all that he is saying about crushing COVID-19 with vaccine this year. He said a lot of things talking about the convention that was held there. There's several other headlines with regards to COVID-19. We have, for example, thousands being arrested for virus-related crimes, and this is in China. If you remember, Wuhan in China was where COVID-19 first broke out. Now, the PTF also launching the Transparency Initiative dashboards. If you recall, at the briefing on Thursday, they did talk about that particular initiative and what we're seeing in Paris and also the United Kingdom, masks being compulsory across Paris as the cases mount, and UK imposing quarantine on arrivals from Switzerland and Jamaica. And what we're getting from Spain is that Spanish children over 6 are to wear masks at school. It's interesting to see all of these measures that state governments are taking amidst a pandemic, COVID-19, until we, of course, can find a vaccine. Don't forget to stay safe this weekend as you go out. Continue to wear your face mask, wash your hands, and all the other necessary protocols, physical distancing to keep yourselves safe. And don't forget, continue to stay with Channels Television. It's your home for the news, for several other updates and news. I'm Millicent Walker. Thank you for watching. Stay safe.